Investigates uncovered that your tax dollars are being used to pay public employees not to work, in some cases for months at a time.
It is happening at the Colorado Mental Health Hospital in Pueblo, which, as we've reported, has already faced issues with staffing. Here's News 5 Investigates. Allison Zimmerman.
For the last month, we've been pressing the Department of Human Services for answers on just how many employees are on administrative leave. This summer, we told you about the hospital's problems with hiring nurses and how it went over budget millions of dollars to staff the hospital with contract workers. On top of that, News 5 Investigates discovered you're paying for some current employees to stay at home every day.
If you're a taxpayer and you heard that there's 15 people getting paid to not work right now, how would you feel?
I'd be horrified. I'd be horrified and angry. It's not good patient care. It's not good use of taxpayer money.
Dr. Sallette Thompson is a psychologist at the mental health hospital in Pueblo.
That's a good boy.
And for the past 7 months,
That is a good boy, yes.
this is what her days look like. At home with her dogs. And she's getting paid.
How long have you been on administrative leave for?
Since March 21st.
Why are you on administrative leave?
I don't really know for sure. I know that there were allegations made by a patient, which is not unusual at the hospital. But I don't know exactly what those allegations are because I've never been officially informed of those.
It's the second time she's been placed on leave in the 4 years she's worked at the hospital.
I was like, oh no, again. And it's a very embarrassing, humiliating process. You have to turn in your keys, you have to turn in your badge, you're not allowed to talk to anyone. It's almost like being shunned from a religious community or something like that. It's a similar, what I would imagine is a similar feeling.
She's not allowed to talk to current employees, and she's expected to be within 2 hours of the hospital in the event they call her in for a meeting. In 2021, she was placed on administrative leave for 3 months. After she made a report over treatment of a patient, she filed a Whistleblower Act violation. But this time, she's left with a lot more questions.
I was told it was a MAIN, which is a major abuse neglect complaint, but that's usually what they're all called. I mean, it isn't, I'm not trying to minimize, but it isn't unusual for patients with severe mental illness or antisocial personality disorder or things like that to have some transference with their psychologist who works with them and blame them for things that are happening to them.
In September, News 5 Investigates first asked the Department of Human Services, which oversees the hospital, for the number of employees on administrative leave from 2019 to 2023. We were told the department has no responsive records to this portion of your request. These actions are not tracked in a central location to query. So we looked at other ways to get the information. I learned the hospital has to notify the department of any employee on leave for more than 20 consecutive working days. So when we asked for that, we received these documents with all employee names redacted.
I want you to tell me, which one are you?
Oh. So they're saying these are the employees and these are the hours they've been on administrative leave for the month?
Yes.
I don't know. I mean, I would say I'm probably one of the ones where it has March listed, but I couldn't tell you which one.
I also learned when employees like Thompson are placed on administrative leave, they're often notified over email. It's not always the case, but I asked for email notifications for administrative leave going back to June of 2021. I was told those records would cost more than $53,000. My boss said that was not in the budget, which begs the question, how can taxpayers know who's getting paid to not work? Let's talk about the number of employees that you have on administrative leave right now. We took our questions to Jill Marshall, the CEO of the hospital.
How many are there?
I believe as of last month, because it's a number that Human Resources tracks, so I believe that there was about 12.
As of last month?
For last month, yes.
For last month. But you don't know how many currently?
Not as of today, because that number is going to wax and wane depending on any given day. So if there were 12 out for the month of September, some of them could be out for a few hours, some of them could be out for one day. So it's not 12 at all at the same time.
At what point does it get to be a burden of someone being on investigatory administrative leave for months or a year?
Well, we don't like to have our staff out that long. We do have to compensate for that. So we do have to ensure that if someone is pulled out of patient care, then there's somebody to pick up that difference. So that means that somebody else needs to provide that service or support to the patient. So if it's a nursing staff, then we would ensure nursing coverage. If it is clinical staff, then we would ensure clinical coverage.
How do you do that when you're already short-staffed and you're relying on contract workers so much? What impact is this having on your hospital?
It is, well, it's less than 1% that are out for administrative leave, like for the month of September. So the impact is really fairly minimal to our staff and patients.
But is there like a certain amount of time where it's costing the hospital more to have this person out on administrative leave than figuring out a decision?
I don't think you can really put a number on patient safety and staff safety.
Marshall says most of the time complaints made that cause the employee to be placed on administrative leave are unfounded.
Unfortunately, sometimes that does take time because there is the law enforcement process, there is the regulatory process, and then there might be an administrative process. So it's just part of our regulations and ensuring that patient and staff safety.
We are legally obligated, and there are time frames that we have to remain in compliance with. There are investigatory steps we have to remain in compliance with. CDPHE licenses this hospital, and if we do not conduct a main investigation in the way they direct us to, they could pull our license, right? We have to comply with how these investigations are supposed to go.
Employees like Thompson we spoke with who are on administrative leave feel they're left in the dark. Thompson says she receives a notification about every 6 weeks letting her know her administrative leave has been extended.
I think the hope is that you'll quit and give up. Because this is so punitive and it's scary and it messes with your head and your confidence and your self-esteem and your belief in yourself as a professional, that a lot of people do give up, and I don't blame them. I don't blame them at all.
What message do you have, though, for those employees that are on administrative leave for sometimes months at a time? I ask because there are some of your employees that think that this is a tactic that's being used to get people to quit.
Well, I would say that's very unfortunate that anytime somebody is placed on an administrative leave, it's really for their protection as well as the protection of the patient. And we talked about protecting the integrity of the investigation. So more often than not, most investigations come back unfounded and the employee comes right back to work. That it can be a process that is concerning to the employee when it first happens, but we're really working to ensure that everything is looked at and hopefully get the employee back as soon as possible.
It's been a long 7 months for Thompson. She too is hopefully going to have an answer as soon as possible.
I understand that concept of, well, you're getting paid vacation, but people forget that this impacts my reputation in the community. This impacts my mental health with the fact that I'm supposed to be sitting around all day, every day, being within 2 hours distance of the hospital in case they call me and tell me I need to come in for something.
Dr. Thompson is just one of several current and former employees that we've heard from. We'll be having additional reports in the coming weeks on just what's going on at the mental health hospital. Andy?
Allison, when it comes to finding out which employees are on administrative leave, what have you learned in trying to get a hold of those records?
Well, Andy, some employee files are considered personnel files under the Colorado Open Records Act. One document that is not are employment applications. We requested applications for any employee on administrative leave. The Department of Human Services said they would give us those applications with all personal information redacted. We reached out to the Colorado Freedom of Information Coalition as we believe These records are public information. CFOIC agreed. We have shown DHS legal precedent and are awaiting their response. We'll be sure to let you know once we have an update. In studio, Allison Zimmerman, News 5 Investigates.